34-year-old Renee Sold paid a visit to this Planned Parenthood clinic in Chicago the same day President Trump took office. The single mom wanted an intrauterine device, or IUD, a contraceptive that's effective for up to 10 years.
With the administration coming in, I knew that there was a good chance that my access to Planned Parenthood or what birth control services and other reproductive health services could be at risk.
Soul's concerns echoed those of many women who marched in Chicago and other American cities a day after President Trump's inauguration.
Our bodies, our choice! Our bodies, our choice! Our bodies, our choice!
They feared the new administration would make good on campaign promises to restrict their reproductive rights by appointing conservative justices to the Supreme Court who would strike down Roe v. Wade, making abortion illegal again. The president may have taken that first step with conservative federal judge Neil Gorsuch, his first nominee to the High Court. But in his recent confirmation hearings, Gorsuch was vague about his views on Roe v. Wade.
Can you tell me if that case was decided correctly?
It's been reaffirmed many times. There's a lot of reliance interest built around it. So I could talk to you about the factors that a good judge considers.
Planned Parenthood's Illinois Policy Director, Bridget Leahy, calls any effort to roll back abortion rights an assault on women's health care.
We believe that women's health care includes a wide range of services and includes access to safe and legal abortion.
Some Illinois lawmakers agree. They have introduced a new bill to help keep abortion accessible here. That legislation, now pending in the Illinois House, would keep abortion legal in Illinois by repealing the so-called trigger language that would criminalize abortion if Roe v. Wade is overturned. It would also provide insurance coverage of abortions for women on Medicaid and state employee health plans. State Representative Sarah Feigenholtz of Chicago introduced the bill. She sees legal abortion as an issue of health and of economic justice.
I know that people of faith really struggle with this, but those same people struggle with poverty and stigma around all kinds of health care. And, I look at this as, an economic justice issue and access for women.
But the executive director of Illinois Right to Life argues expanding abortion coverage to Medicaid recipients and state employees is too costly and irresponsible for cash-strapped Illinois.
I think the majority of Illinoisans on both sides of the aisle would say we don't need to increase the number of abortions, we need to fix our state and have our legislator get back to work doing that.
Governor Rauner campaigned in favor of keeping abortion legal, but he has not said whether he would support new legislation that protects abortion rights in Illinois. And while Feigenholtz says her bill is crucial in preserving reproductive rights for women, even she admits the legislation could be a tough sell.
I think that there remain a lot of people who don't really look at this bill as a path to economic justice for women, and there is a lot of pressure and a lot of resistance, and it's not going to be an easy bill to pass.